This is the biggest secret in psychiatry, and it's that antidepressants don't save lives, at least not at the population level, because a recent analysis of the FDA placebo-controlled trial data published in the Journal of Affective Disorders found that people taking antidepressants had more suicide attempts and even more suicides than those taking placebos. As the authors put it, these analyses consistently hint at an elevated risk for suicide attempts and, less reliably though, also for suicides in cohorts of adults exposed to antidepressants. This is remarkable for a drug that is used to treat depressive symptoms. Guys, this isn't just some fringe thing that Dr. Josef is saying. This is in the Journal of Affective Disorders. This is one of the major journals in psychiatry. In other words, a drug that is meant to help with depression, by lowering depressive symptoms on a scale, may actually be increasing suicide at a population level. Now, if this sounds completely absurd that we've put like 14% of our population on these drugs, which actually worsen the outcome that you care about, it's because it is. There's no real way around it. And we should talk briefly as well about why some people become more suicidal on these drugs. And it could be a few reasons. One, the drugs can paradoxically worsen symptoms in some people. That means they take it and they become more agitated. This is just natural variation in how people respond to drugs. That can push people into suicide. But also the emotional blunting that is the drug effect of this for most people may dull not only the pain, but also the natural fear of death and the guilt that stops someone from acting on their suicidal thoughts. Either way, what I have to say is prescribing these drugs broadly to 14% of the US population is reckless, and it should only be reserved for extreme cases after all other options have failed. Why else would you try this unless all other options failed? And so the next time someone scolds you for talking about the risks of antidepressants, or you might scare someone away from taking these medications because it is a life-saving drug, just remember that the science does not back up that narrative.